Welcome to ISN webinar series. The title of my presentation today is Leading an Active Lifestyle During COVID-19 Movement Restriction Period. What tools do we have? I would like to first inform you that this is actually a pre-recorded session. We're doing this because we're trying to ensure the quality of the audio-visual system. So again, why I do this topic is I think it's really important for us to keep leading an active lifestyle during this COVID-19 movement restriction period. So what I'll cover today, first is to talk about the challenges we face during COVID-19, MCO and active lifestyle. Next is stop sitting on the problem, because during COVID-19 period we could be sitting a whole lot of time, and we try to offer a bit of practical solution from current research. And hitting and sitting towards health and fitness. The HIIT is current trend, and the SIT actually are very popular, and we're going to talk a bit about that, on how we should use that to improve health and fitness. And whether we can use exercise as snacks, a new concept, an eccentric way of exercise. We'll look at exergaming as well. Does it really work? And we'll look at alternative and complementary strategies, if enough time. So first of all, COVID-19 movement restriction, what it means to us actually. I'm sure you agree with me, during this period of time, you increase a lot of your sedentary or sitting time. For example, myself, the first week of movement with MCO, I already received a lot of SMS about video links to free movie online, and actually watched 3 movies in a week. That's sort of a record for me. That's like the whole year movie for me. I don't normally go to cinema and watch movie unless strongly requested by my son. So my children, sorry. So that increased my sitting time by about 6 hours in that particular week. But I'm sure a lot of people, because you can't go out, what you can do is probably watch TV, checking emails, checking your phones, work from home, sitting all the time. And worse is, if you look at this picture, as you watch TV and doing all these things, you probably have endless supply of food. So that could include binge eating as a risk factor as well. And on top of that, there's a huge reduction in exercise opportunity, we believe, in the sense that you can't go outdoor. People believe it's not safe, so they don't dare to go out there. So activities that normally we do, we can't actually do. And the interesting thing is, if we put all this together, it's actually quite a big risk factor for reduction in metabolic health. So the famous Metabolic Syndrome, which Malaysians are currently having, we arguably, or actually we are the regional champion in obesity and probably type 2 diabetes as well. So for a start, we'll look at increased sedentary and sitting time. What can it do to you? For the past decade or so, there has been a lot of research being done on sitting time and the detrimental effect on health. By looking at TV viewing, I think this is the easiest way to measure. So if you watch movie for 2 to 4 or 4 hours, more than 4 hours a day, it's actually detrimentally associated with a lot of health problem, like metabolic syndrome, abnormal glucose metabolism, diabetes, overweight, cardiovascular risk, cancer. So these are all the common things that we see if you sit for too long. And the worst thing that can happen is actually all this problem can happen independent of leisure time physical activity. What it means is, even if you exercise, say for 15, 20 or 30 minutes a day, if you sit for a long time, watch movie more than 4 hours a day, you still have this bad effect. And Professor Neville Owen summarized it pretty well in 2008. Sitting too much is not the same as exercising too little. So even when adults meet their physical activity guidelines, sitting for prolonged periods can compromise metabolic health. So in view of all these results and the research, people start to recommend some exercises. So they recommend that you should actually break sitting time at workplace, because that is the time that you spend the most for adults the whole day, because we basically spend at least 8 hours at work. So some suggest calisthenics exercise, as indicated in the picture. You can do some squats, bench deep, calf raises, bench push-up, and so on. So these are some exercises you can do from time to time. Maybe every 1 or 2 hours you have to do this. Some even propose 20 or 30 minutes. So some actually propose changing the lifestyle. So you're standing up meetings. Some can be conducted on trampoline, standing up at work, standing up meeting, walk up staircase instead of using lifts, and walk to your colleagues, printers, and so on. So these are the recommendations. But the problem is, a lot of all these studies are conducted on acute studies. So the control group is actually people that sit the whole day. But in reality, we don't sit the whole day. Even when I was in basically applying sedentary lifestyle a few years back, when I was the CEO of the institute, I still achieve about 3,000 to 4,000 steps a day. So to have people sit the whole day and compare against all these interventions, maybe we are missing something. So whether the effect is really the exercise effect, the breaking sedentary effect, or whether it's the detrimental effect of sitting time, so we don't really know. So to answer the question, actually, we look at the literature again. We found a study that actually did to look at this, to study this question, actually, to look at training effects of short bout of stair climbing on cardiorespiratory fitness and so on. So what they did is they have people walking up staircase a few times, from 1 to 8 times across 8 weeks, gradually. And what they found, interestingly, was the VO2 max of this group of people actually increased as compared to the control group that remained sedentary. And the bad cholesterol, the LDL, actually reduced significantly in this group as compared to control that do nothing, that still run a sedentary lifestyle. So that's pretty encouraging. So using stair climbing activity just a few times a day. But the problem is, would you use staircase in between your works or meetings? Would you do that? And especially if the staircase is not within reasonable distance from you. So I think the staircase is about, in my office, is about a good probably 200 meters away from my office. So will I walk 200 meters to go to the staircase and do this? Probably not. Not for me, at least. But will you use it if the staircase is just next to you? Probably yes. I can stop the work for just 2 minutes and then do something about it. So in viewing of this thing, we try to come up with something practical to solve this problem by moving the staircase to our office, actually. So this study was actually conducted by Suresh Moratamuthu, one of our scientists at the institute. So what we used was actually a stat board. We put it in the office next to the staff. So we get 36 sedentary public workers as subjects. They use stat board. They perform stat board exercise at work. So they perform 50 steps in 2 minutes, 4 times during office hour. That's 2 hours. Every 2 hours they perform 50 steps, 5 days a week for 8 weeks. Pretty much similar to the previous study, except that we moved the staircase now to the office. The subjects were reminded by SMS. Okay. And before and after the intervention, we performed oral glucose tolerance test. So surprisingly, in this result, in the intervention group, we didn't actually see an improvement in glucose tolerance. But we actually see in the control group, who still practice sedentary lifestyle. These are people that walk only 3,000 or 4,000 steps a day. In 8 weeks' time, they actually got worsened. The glucose control actually got worsened in 8 weeks' time. So in other words, this stat board thing is actually good and to maintain your health, to help you to maintain your glucose tolerance. Okay? If you don't do anything, you're gonna get worse in 8 weeks. But step board exercise help you to maintain your glucose tolerance. So that's sort of explained too. In those studies, acute studies, what they did was the control group may not explain everything. So the effect is partially due to the detrimental effect of the control group. So take home message number 1. So during MCO period, you really want to break sedentary time frequently, and if best every 1 to 2 hours. I'll say even 30 minutes if you can. If you're watching a lot of TV, you're doing work continuously non-stop, and if this step board exercise are too easy for you, you can do some variation. As in this picture, you can perform a knee lift, or you can perform side to side if it's too boring from time to time if you keep doing the same thing. So next we're going to look at another picture, which is reduction in exercise opportunity. So before I start, I would like to draw your attention to this article published recently in BMJ Opinion, which mentioned about home-based exercise activities could help during self-isolation. So what they argue is, during this COVID-19 period, the recommendation has been just focused on minimizing the spread of the virus. Okay, the spread of the virus by self-isolation, reduce social contact, and hand hygiene. But that's just to minimize infection rate. But when we look at all the people that being infected by COVID-19 and have a lot of risk, are those people at advanced age with pre-existing illnesses like hypertension, chronic respiratory disease, and diabetes. So the thing is, all these things can actually be enhanced, the situation can be improved by exercise. And why? They question, why don't we recommend exercise? So the concept is like this: instead of just having people try very hard to prevent the disease, we need to somehow get the people to be ready to face the disease if they are being infected. So they propose exercise guidelines need to be given out. So why exercise? I think there are so many good things about exercise. It's a polypill, we now call it, that can improve every single thing that we mentioned just now about hypertension, about improved lipid profile, about diabetes, and so on. And the key thing is also, it can strengthen your immune system. So that's why we're proposing, instead of just ask people to actually perform things to prevent the spread of the disease, the virus, we should also ask them to actually exercise, encourage people to exercise and get themselves healthy and strong to actually, when they are infected by the disease, they can handle it better. By doing that, one thing to remind you is we don't encourage people to do prolonged, strenuous exercise like those marathons, half marathons, and so on, unless you've been doing that for a long period of time. It's not a good idea because that can compromise your immune system. So you look at current exercise guidelines, as adults should get at least 150 minutes of exercise, moderate intensity exercise. I think everybody know about this. They should train each major muscle group 2 to 3 times a week using a variety of exercises and equipment. And they should do flexibility exercises at least 2 or 3 times a day. So I think the whole idea of this presentation is not to tell you about what you can do, this and that. I think you can still carry on with your running exercises if you wish so, your cycling exercise, Zumba, your aerobics, your stretching, your Pilates, and so on. Just carry on with it, but just be safe, follow guidelines, social distancing, hygiene. Get medical clearance if you have never done exercise before or hasn't been done that for a long time. But and do some home-based exercise to reduce the risk. Make sure the environment that you're exercising is safe, the equipments are safe, the facilities are safe, the flooring not slippery, proper shoes, every single thing. And always exercise supervised, actually either with a trusted partner or supervised by remotely or virtually by a trainer that you can hire. So before I step into what are the tools that we can have, it's reasonable for us to look at common reasons why people don't exercise. Why don't they stay active? I think the most famous one is actually, I don't have time. I'll be the first one to put up my hand a couple years back. I always use this excuse, and that's why I put up a lot of weight. I won't tell you how many kgs I put on, but it's just not good. And no place, facilities, or equipment is not convenient. I'm not good at exercising. Who's good at exercising when they're first born? You just gotta do it. I'm not fit. I'm too old. I don't like and I don't enjoy workouts. So all these things actually contribute to why people don't exercise. So the whole idea of this presentation, we try to answer all these questions on why you can do, and then to counteract all this reason easily, and for you to practice active lifestyle after this. So what tools do we have easily when you look at this is to move all the exercises indoor, having a bike, a virtual training system, a wind trainer or so on, a treadmill at home. You can still do Qigong at home, Zumba at home, just follow the TV, the instructor, or yoga at home, Pilates, aerobic session. There are quite a number of things you can do at home. But what we are not sure now is actually what we're trying to introduce is some other things and some of the guidelines that you can do to some of the other things that you can do that maybe we can't think of. So the first one is actually high intensity interval training and sprint interval training. This thing has gained a lot of popularity. I mean, HIT has been there for a long time, a long history, but over a decade or so, or maybe 15 years or so, this thing has gained a lot of popularities. Things like spin cycling, Tabata, and all these different calisthenics. All this has been used very commonly, and you can see just, I think, go to Facebook or any of the social website. You can actually look at a lot of all these exercises. But what I want to discuss here is about this man and his work, Mari Gibala from McMaster University. I think they perform a series of studies to answer this question, actually, how little can you exercise and still get the results? This is what we want to know, we want to tell you. So I think this is one of the very first study where they have subjects come in and perform sprint interval training. You're talking about real sprint cycling, 30 seconds all out cycling, 6 repetitions in a day, separated by 4.5 minutes of recovery, only 3 times a week for 6 weeks. So that's very little exercise. And what they show is actually you can get similar metabolic adaptations as compared to 1 hour of moderate intensity running, which is amazing. The mitochondria and the performance all increase after this, similarly compared to when you exercise for an hour. So that's a good thing. But the problem is 6 times all out cycling. That sounds tough even for me, and it's painful. A lot of people may not like it, so they came up with another solution, which is they lower the intensity to about 90% of max heart rate, do only for 60 seconds, and 10 reps interspersed by 60 seconds of rest. That made the whole exercise sessions about 20 minutes or so. If you put 5 minutes warm up, that's 25 minutes. 6 sessions over 2 weeks. 3 times a week for just 2 weeks. They see good outcome in type 2 diabetes patient. They help to reduce hypoglycemia and increases mitochondrial capacity. So that's pretty exciting result. So this is actually quite doable. Okay, this is actually quite doable. So I encourage, if you don't have anything to monitor, the heart rate monitors, just go with your RPE, the perceived exertion, and move progressively. Okay. So another thing that I would like you to look at is actually this thing that very popular, Tabata. I think a lot of people know this. I think I might have seen like 50 Tabata sessions on Facebook or Twitter and so on. So I think it's important to just mention about this study. Couple years last year they did cardiorespiratory fitness and muscular endurance, a comparison between Tabata and vigorous intensity continuous exercise intervention. So what they did is they get healthy young adults into a non-exercise group, Tabata group, and vigorous intensity continuous group. for a 4-week supervised training period, 4 sessions per week. I'm going to cut out what they did, so just go straight to the, due to time constraint, just go straight to the results. And what they concluded is the vigorous intensity continuous exercise, I think about 30 minutes they did at about 85% heart rate, appears to be more effective for improving cardiorespiratory fitness, whereas whole body Tabata confers large improvements in muscular endurance performance following short-term training, the 4-week supervised training. So this is, I think this is reasonable. It doesn't mean Tabata is not good for cardiorespiratory fitness, it's just it worked more in terms of muscular endurance. I think that's reasonable in the sense that with Tabata you actually do a lot of muscular exercises like push-up, the burpees, the jumps, the squat, and so on. So if you wish to actually increase the cardiorespiratory part of it, maybe this is what you can do. I've noticed this a few weeks ago in one of the Facebook friend of mine, Coach Sun from Pioneer Badminton Academy. So I'm not sure whether this should be called a Tabata, but it certainly follows Tabata principles of 20 seconds work and 10 second rest. So I actually converted all the badminton actions and movement into these Tabata exercises, and make it into a badminton Tabata. So it can have a attack badminton session, defensive badminton sessions, without shuttlecock I mean. So it's all about movement. So with all this movement and less of those muscular activity, chances are you can actually improve your cardiorespiratory system more. So you can always play with all this sort of variation. I think there were some that did martial arts Tabata. So that's something you can do as well. So to prevent boredom working out at home, I think it's good that you provide some variation here. So take home message number 2 is the high intensity interval training and sprint interval training are very time efficient way of improving health and fitness. If you don't have bike, you don't have treadmills, you can use staircase or step board. Just be creative and you monitor the intensity with perceived exertion and train progressively. So the picture here is actually Mr. So Wai Ching. It's actually our world number 2 tower running athlete. And unfortunately, Wai Ching actually stayed in an area where he experienced enhanced MCO, total lockdown, so he can't get out of the house. So this is what he did. He put a video up on his Facebook, a small bench like a step board. He just step up and down for training and control the intensity by the quickness of the drill. So vigorous continuous exercise, 30 minutes at about 85% heart rate is good for cardiorespiratory fitness, whereas Tabata works for local muscular endurance. And you may provide variation to Tabata to prevent boredom and to stress whatever system that you wish, whether it's muscular or cardiorespiratory. So I hope so far it's clear. And the concept of exercise snacks, it doesn't mean as we exercise we eat snacks, but rather can we treat exercise like how we eat snacks. Okay, the concept comes when people ask this question: if I'm unable to do high intensity interval training or sprint interval training in one session because it's tough, the 30 seconds, the 1 minute, can I break them up into several more manageable sessions? Can we do that? So it's like us having snacks, right, a few times a day. So to answer this question, again, the same group of people, the Canadian John Little, Mari Gibala and gang, they studied this by looking at sprint exercise snacks, whether it's good enough to increase aerobic fitness. So what they did was they actually recruited healthy young inactive adults, 2 groups, 18 training sessions for 6 weeks. That means 3 times a day for 6 weeks. First group performed sprint snacks, 3 times all-out exercise, bout separate by 1 to 4 hours of rest. So that means sprint, 20 seconds one time, rest, you go and do your work, you do whatever you want. After 1 or 4 hours, you come back, do another time. Okay? After that, rest, you do whatever you want at work. Again, you do just 3 times in that day, 3 days a week, and then for 6 weeks. So the other group performed traditional SIT. That means 3 times 20 seconds. You just do all in one session, separate by 10 minutes. All within a 10-minute training session. What they show was rather surprising. With that minimal amount of exercise, you can actually increase the VO2 peak by about 6% in SIT and 4% for snacks. That's not too bad, and it's not significantly different between these two. And time trial performance is actually improved by 13% in SIT and 9% is in sprint snacks, and with no difference between groups. So both groups are actually equally good. Maybe a bit not as good in a snacks group, but what it says is actually the sprint, so-called the exercise snacks concept actually worked. So the conclusion is cardiorespiratory fitness was similarly increased by a protocol involving sprint snacks spread throughout the day and a traditional SIT protocol in which bouts were separated by short recovery periods within a single training session. So now you don't have excuse, you just do. So if you can't do 3 sessions, you can't do long sessions, just do short break like this. But the next question is, should I perform the exercise snack sessions before and after meal to make it better? So a group of scientists from Otago, New Zealand, Jim Cotter, and in collaboration with John Hawley from Melbourne, they performed this study. I have to clarify here is they don't actually compare with after meals. So they do it before meals with the intention, they thought by doing it before meal it's going to be better. So they take the exercise snacks concept to another in another direction. So they get people with insulin resistance, or what we call pre-diabetes, right before you get diabetes or pre-diabetes. So when you start to have insulin resistance, and actually 2 of the subjects are diabetic, okay? So one group performed 30 minutes moderate intensity exercise, 60% heart rate max. So this exercise is incline walking right before lunch. Right before lunch. Made a mistake there. Right before lunch, as you can see, it's incline walking. It's tough, but it's not that tough. And for 1 minute. For 30 minutes. Exercise snacks consists of 6 times 1 minute intense session, 90% heart rate max, with 1 minute recovery in between. Incline walking intervals 30 minutes before every meal. Breakfast, lunch and dinner, 30 minutes before they do this. 1 minute of intense incline. It's still walking, even though 90% heart rate. It's still a walking session. And the composite exercise snacking session, this time they do a 6 times 1 minute interval between walking and resistance-based exercise 30 minutes before meal. So the meal timing and composition were controlled within participants for exercise intervention. And very encouragingly, they actually show some good effect in the exercise snacks group. So 30 minutes before they take every meal, they just perform 1 minute of exercise, incline walking, intense incline walking. They help them to improve their glucose regulation, their blood glucose concentration during exercise day, and this effect actually persisted the next day as well, the day following the exercise. So the results pretty encouraging. Against what people believe, you need to exercise long period of time, you need to do this and that, you need to have sophisticated equipment. What it means probably is you have to do it right, maybe. Even exercise snacks you can do. So the authors concluded that dosing exercises, brief, intense exercise, snacks before main meals is a time-efficient and effective approach to improve glycemic control in individuals with insulin resistance. So now next, what can I do if I can't access a bike or treadmill? I don't have a bike, I don't have a treadmill. What can I do? So again, Mani Gibala did this study. They've done quite some remarkable studies, a very practical study over the years. Do stair climbing exercise snacks improve cardiorespiratory fitness? Now you don't have time, it's fine, you have staircase. Can you run staircase instead? Same thing. 3 days a week for 6 weeks, and 3 times in that day. Sedentary people, 24 sedentary young adults, 3 bouts per day of vigorously ascending a 3-flight stairwell of 60 steps. That means they sprint up 60 steps, separated by 1 to 4 hours of recovery, 3 days a week for 6 weeks. So the exercise neck concept is still there, and you apply using staircase. So there's another non-training group. So what they see was really encouraging, in the sense that the VO2 peak actually increased in the intervention group only. I mean, although marginally, this is difficult to increase, but when you look at the power output, it increased significantly. Peak power output is the indication of functional performance. So this is very encouraging. That means if you don't have anything, you can still use staircase. Okay, so take home message number 3, exercise next concept actually work. If you can't exercise the full session, break it up, but the exercise sessions has to be intense enough. Okay, so these are some of the options you can have, but again, train under supervision, because this could be intense or with virus-free partner. You're pretty sure that's your family members that you know they are not having COVID-19 or so. So now, again, when we look at the reasons not to exercise, a lot of people complain about they are not fit, they are too old, they do anything along those lines. So what if the stair climbing exercise is too tough for me? It is tough. It's sprinting up staircase is tough. So in view of the question, I think a group of scientists from Taiwan, in collaboration with Ken Osaka from Western Australia, did a study, very interesting study, on effects of descending stair walking on health and fitness of elderly obese women. Okay, they recruited obese women more than 60-year-old. These are people that cannot sprint up staircase. Okay, very practical study. Descending stair walking or ascending stair walking group, 15 in each group, and they use an elevator to achieve the purpose. So that means those that walk downstairs, they'll take lift to go up to 6th floor again, and then go downstairs again. Those that go ascending, they'll ascend up to 6th floor, and then they'll take the lift down. Okay. They perform twice a week only for 12 weeks, with repetition increased gradually to minimize muscle soreness. The reason why they choose downstairs walking is because it's an eccentric exercise. So eccentric exercise is known to be able to cause muscle soreness. So to reduce the effect, and they did it right, and with minimal muscle soreness, they start gradually. So 2 times increase by 2 reps every week. So by the 12 weeks, they were performing 24 reps. So each rep is 110 steps and 17 cm per steps, okay, at the pace of 1 second per steps. It's not too fast, it's not too slow, just nice for all these obese people, obese women. I have to tell you, I was quite shocked by the result, in the sense that we thought by moving upstairs you can actually achieve better result because metabolically it's more intense. But when we look at the result, so the descending group actually have better increase in bone mineral density in, I think it's calcaneus bone. They have better glucose handling, like the HOMA-IR, all these are glucose tolerance tests. The HbA1c also improved in the descending group, and they also improved their lipid profile. Okay, the bad cholesterol, the good cholesterol, and the total triglycerides, and so on. So these are all improved in the descending group, the eccentric exercise group. And more importantly is they improve their functional fitness with all these strength tests, the functional tests, they have balance tests. It all improved to a large degree in this group of people. So the author suggests that they supported the hypothesis that descending stair walking will be an effective exercise intervention for elderly obese women. So it appears that the descending stair walk can be used as effective exercise intervention for less fit individuals to improve their health and fitness. And they suggest that muscle contraction mode should be considered when prescribing exercise medicine. Okay, So I think I'll skip this part because you probably understand now what is eccentric exercise. Exercise when you during muscular contraction, the muscle actually lengthen. So in this manner, you'll be like this. When you lower the weight, it's eccentric contraction. When you lift it up, it's concentric. Same thing. When you lift it up, it's concentric for the core muscles. When you lower it down, it's eccentric training. So it's actually easier when you lower it down, right? Okay. Again, downhill running, downstairs walking, all these are eccentric exercises. So again, in collaboration with some Japanese scientists, they did a study comparing eccentric and concentric resistance exercise without equipment. Look at strength and functional fitness of older adults. So they recruited healthy older adults, 65 to 84 years old. They performed 4 to 6 basic manual resistance exercises, either concentrically or eccentrically. They performed once at a community center, at least twice at home for 8 weeks. They measured muscle thickness, strength level, and all the functional tests and balance tests as well. These are some of the example exercises that they did. Okay, the black arrow indicates the eccentric training, like they sit down slowly and then somebody helped them to stand up. Whereas concentric group, actually they help them to sit down and then they stand up by themselves. So that kind of concept, without exercise equipment, the beauty of this test, this research, and what they show is the eccentric manual resistance training was more effective for improving lower limb strength, mobility. Actually, everybody improved, but the improvements is more actually in the group that perform eccentric exercise in terms of strength, mobility, postural stability, when compared with concentric training. So this suggests the significance of emphasizing eccentric muscle contraction in movements to maintain and improve physical function. So take home message 4, for aging or unfit population, eccentric exercise can serve as an effective tool because it's not metabolically tough. So progressive descending chair, stair walk, eccentric manual resistance training. If staircase not available, you may consider step walk again because that involves both concentric and eccentric action. So next, for kids, what can we do? Exergaming, I think is a very popular thing now. I think a lot of kids will play this, but does it work? Is it good enough? So to answer this question, I think a few years back, we did a study at ISN, and this lady, Madam Shazalina, did this study by comparing energy expenditure between Sukan Rakyat, which is traditional games played by kids, against exergaming. So they recruited 40 healthy adolescents between 10 and 11 years old. For exergaming, they play 4 different types of games, Xbox games, mainly sports. Every 15 minutes, they change a game. So they rest for 5 minutes every 15 minutes. Whereas traditional games, they play different types of traditional games like those Polycentric, Gala Panjang, and so on. Every 15 minutes, they change a game and then they take a 5 minutes break. So what they found was, encouragingly, for exergaming group, the energy expenditure was not too far behind and it's not statistically significant. The only downside is actually it's not as intense as revealed by metabolic equivalent of task. It's actually higher. The intensity in a traditional game is actually higher. So when we break this down into activity, we can see it quite clearly. So the exergaming group actually spend more time in sedentary and light activities, whereas the traditional games group actually spend more time in moderate or vigorous physical activity time. So I think 2 conclusions we can make here actually. One is exergaming can do the work if the focus is only on energy expenditure. You want your kids to be active, burn a bit more energy, then it works. So, but in terms of intensity, maybe it's not enough. What you need to do maybe is to choose game with higher intensity, or actually when you perform this sort of exergaming, just supplement them with a bit of high intensity exercise. So again, what about aging population? Can they benefit from exergaming? It's kind of popular now that people are using all these what we call physical and cognitive exercise system. So I'm not going to talk a lot about this because I think time is running out. So they look at 3 months of in-home pilot clinical trials for mild cognitive impairment and the caregivers. So as you can see on this picture, this old gentleman is pedaling a sort of bicycle thing here underneath, and at the same time he needs to respond to sort of computer game and make some decision there. So these are things that they have to do at home, and encouragingly they can see good progress. In 3 months, the group that play all this, the eye paces, actually improve their executive function. In this older group of population, the subjects, they actually improve the executive function, and also apart from that, they improve their memory. Okay, in this group of people above 60 and 84 years old, they actually improve their memory. So this is actually a good thing by a large margin. So in other words, exergaming can be good for them. So during COVID-19 time, maybe this is something that we have to ponder, and especially with 5G coming to town, I hope maybe by next year or so, all these things can work out in a better manner. So take home message number 5 for aging or unfit population and kids, exergaming can serve as an effective home-based tool to enhance health and fitness. For children and adolescents, exergaming seems to be an effective tool to increase energy expenditure. And advice is to play exergaming that are of higher intensity, or supplement exergaming with higher intensity exercise. However, games and sports are still the better choice for children if you get a chance. So I'm not endorsing or encouraging exergaming here. I still hope you guys can do some home-based exercise and arrange some exercise session or game session for your children at home. I believe my colleague will actually run a session of exercise session for children and for older population in a week or so time. So watch out for these sessions. The last one that we'll look at is alternative and complementary strategies. I'm not going much into detail. I just want to tell you that a lot of research has been done on yoga and qigong. They are all good for you. A lot of health benefits. So what you can do is actually do it virtually, or pick up all these things which you can easily perform at home. A lot of different population can benefit, not just old people. And one last study that I'll present is actually just to show you how easy it is again to get healthy. It's a research performed by a Korean physical therapist. So they look at effects of passive static stretching on blood glucose levels in patients with type 2 diabetes. So these are type 2 diabetes people. They perform passive stretching, that means partner assisted. The physical therapist actually helped them to do this. So they have 15 sedentary patients, all type 2 diabetics. They randomly assign them to passive stretching group versus control group for 8 weeks, 3 times per week, 40 minutes static passive stretches with 6 lower body and 4 upper body exercises, and stretched for 30 seconds and was repeated for 4 times, and each repetition was separated by a 15-second relaxation period, and different stretches were separated by a minimum of 1 minute. That sounds easy, right? But you need to have a qualified people to help you to do that, experience in passive stretching, okay? So what they found is really, really interesting to me, at least. The HbA1c is actually an indication of the seriousness of your diabetes. And in control group, these are people that take their medication, okay? They continue to take their medication, both groups. And the control group actually, in the control group, the HbA1c level actually doesn't change. Whereas in the passive stretching group, they don't actually exercise. Not really, they do exercise, but it's helped by people. They stretch them, and what they get is actually an encouraging decrease in HbA1c levels after 8 weeks of passive exercise. Okay, I hope this result will encourage you to actually look at exercise as not so difficult. Now we go back to all these common reasons for not being active again. Don't have time, don't have facilities. I hope that all the previous studies that I've mentioned here, the presentation I did already cover all these. Not fit, too old, you don't enjoy, you can do exercise, gaming, no facilities, you can do this and that. I hope this presentation has actually given you some ideas about what you can do, and in a very practical manner. And we have checked all this. So if you start to pick up some exercise today, or be active, just break the sedentary lifestyle, I think the time spent for me to prepare this presentation is not wasted. I certainly hope so. Okay, with that, I would like to thank the team research in ISN, past and present, all the members, lovely members of team research. They have helped me over the years, not just in research itself, managing the whole research system in ISN. They've been wonderful time with them. I hope we can all work well again and many more collaborations in the future. And I think I have to do this as well. Special thanks to all the frontliners in Malaysia and everywhere else in the world, the doctors, the nurses, the bomber, the police, the Navy, the Army, and so on. All these people that sacrifice their time and effort and risk their life to help us in combating this COVID-19. Your effort is very much appreciated, and I wish you all the best in fighting COVID. I wish all of us the best in fighting this COVID-19, and hopefully we can all go out and play sports and games soon. Thank you very much.